as we are now acutely aware, the interconnectedness of our body segments presents challenges, but it also presents us with opportunities to augment our treatments and rehabilitation. An assessment of the kinetic chain might include, first of all, a postural assessment. And we would do this standing, looking at our clients from the front to see if there are any disruptions from side to side, looking at our clients from the sides and noting the position of the plumb line in relation to the earlobe, the acromion, the greater trochanter at the hip, the knee joint line, and the ankle joint. Looking from the back, again, we're looking for lateral deviations, but we can also observe the alignment of the pelvis, the lines at the gluteal folds, and also in the center of the knee joint, and noticing any malalignments through the feet. Now, this is something that we have covered in our lower limb biomechanics course in much more detail. We would have a look at gait. I think it's always important to see our clients moving, and whether we do that surreptitiously or on purpose is really entirely up to you. So let's just have a little look at Jack walking. And we really want our clients to be as natural as possible. So putting them at their ease and being comfortable as they are in the room with us really matters. That's it. And so we're just observing for any anomalies. The other thing that's quite important for us to observe from the point of view of the upper quadrant is the arm swing. Now, it's quite difficult for Jack to get any arm swing because he's not walking very fast. There's not very far for him to go. But to observe the volume of the amplitude of the arm swing and also the speed, and for us to just be mindful of that. We can move and look now at balance, and this is going to bias the lateral line just a little bit more. We can ask our client to stand on 2 feet side by side with the feet close together and just notice for whether there are any wobbles side to side or disruptions in the balance. We can invite the client to move to a split stance with the semi-tandem to begin with. So the feet are not directly in a line, hip distance apart, and then just notice how they adopt these postures. Moving between postures is another opportunity for us to evaluate our clients, and then swap sides and do the same thing on both legs. Similarly, with the tandem stance, the heel and the toes touching, and just observe your client's ability to be stable. We could challenge them by inviting them to close their eyes. That's really for us to choose depending on the client in front of us. And so we are moving on now to look at sit to stand. And we could do this using a chair or just a freestanding squat. So let's have a look at Jack now, again from the front, the side and the back, just to see what kind of strategies he adopts as he goes about a squat. Thank you. Very good. And repeat. And we'd ask them to do a few, provided they're not too prone to fatigue. And go sideways if you would, and let's look at that from the side. So particularly from the side, we get to look at the spinal mobility, the lumbopelvic control, and this is biasing the spiral line. Also the hip, knee, and ankle control. And so we can look from behind again. The more that we can get around our clients, the more information we're going to get from our evaluations. Perfect. So let's move on now and come to the spiral squat. This is fun, this one. So you're going to reach down towards the outside of the opposite ankle. That's it. And then come up and go the other way. So we don't want it to be too much of a performance from our clients, really making it something that's natural movements as much as possible. Very good. And so we'd be looking at the hip and knee and ankle strategies as we move. And again, evaluating the spiral line with this. The single leg squat is another step, adding more challenge. And not all of these tests are going to be suited to your circumstances. So this is a repertoire of choices that you can take. So our single leg squat, again, really exposes the hip, knee, ankle strategies. Lumbopelvic control, that's the lateral line, and also the superficial front and back lines as we observe. And always this comparison side to side, particularly if we're dealing with a one-sided dysfunction, a problem associated with one arm, then we're intrigued to know if there are any differences from side to side. Moving to look at something a little bit more dynamic, we can invite our clients to take a step forwards and evaluate the strategies. So we're looking at the superficial front and back lines and also the lateral lines. Try and make these movements spontaneous, and it's really difficult when people are being observed, but as much as possible we put them at their ease. Very good. Do that again. Wonderful. And so we're observing for differences side to side. Looking now at the heel raise test. This has been shown to be quite revealing in athletic populations. If we set a metronome to 60 repetitions a minute and we perform the exercise to failure, somewhere in the region of 25 repetitions is indicative of reasonable calf strength. And so let's see Jack up and down on the tiptoes. And this is challenging the superficial back line. And we could, of course, compare sides by doing one leg at once. Not all of our clients would be suitable for this, but maybe if they held onto a wall or the back of a chair, single leg calf raise might be accessible, and then the other side. And we're just comparing sides. Perfect. So moving on now, we'll look at the roll down. Rolling down from the top, chin towards the chest, peeling the spine away from an imaginary wall at the back of you. These are the visual pictures that I love to paint for people. Allowing the arms to fall forwards away from the thighs and just roll down as far as we can towards the ground. And then uncurling. Feel like the spine is unfurling and uncurling bone by bone by bone, and then returning to the top. And this is really showing us spinal mobility, but also the lengthening potentials of the superficial back line. We can look at the superficial front line by asking our clients to move towards extension. And if you would stand side on and place your hands in the small of your back and extend over your hands. And we're really just looking for the length tension relationships in the superficial front line. And then a full extension with the arms reaching. Again, this may not be accessible to everyone, but we can really observe the whole length of the line as we do this, incorporating the arm line as well. The mermaid reach to the side is a movement taken from Pilates that I really love. And so if you would reach the arm, soften the knee, and then take a look and give yourself a wave. That's it. And turn the head towards the hand. And this way we're really incorporating the head, the arm lines, the lateral line. There's a lot going on here. And swap sides, and then we can just observe any lateral restriction. So do allow the pelvis to drop on that side. We're really getting that length at the obliques being brought into question. And then lower, release, and relax. Perfect.